Why is Botox contraindicated in pregnant women? This is a great question. I'm Dr. Victoria M.A. I'm a board certified plastic surgeon in Scottsdale, Arizona, and today I'll chat with you a little bit about it. So just for some background knowledge, Botox is actually a protein that is made by a bacteria called Clostridium. And what it does is it prevents a nerve cell from talking to a muscle cell. So the muscle cell is not getting any signal at all, and it doesn't know what to do, so it is effectively paralyzed. Now, there are a number of these on the market. There's actually 6, and you can see them all above here. You probably are familiar with several of them. And they all do the same thing, causing this muscle paralysis. So at very, very high doses, we would see botulism, which we did see when patients were getting counterfeit Botox in the last couple of years. But at very low controlled doses, we actually get exactly what we want. We get paralysis of very specific muscles, and we actually inject them in the points where we want them to have that paralysis. Now, in theory, a very small amount of this Botox could escape that local area and get into the bloodstream and travel throughout the body. What we actually see is that amount is very, very tiny, and at cosmetic injection doses, it's basically undetectable. So how does this have to do with the placenta and a fetus? So essentially, the Botox could, in a very small amount, travel from, your forehead, your glabella, into your bloodstream and all the way down to your placenta. And then what happens? So the Botox protein is actually quite large. And even though it theoretically can cross the placenta, it doesn't have an active transporter to do so. So remember, it came from bacteria, so our body doesn't make a transporter to naturally transport it across the bloodstream into the placenta. It basically would have to be in the right place at the right time and just happenstance across the placenta, because no one is going to take it for a ride across there. And remember, it had a very low likelihood of escaping the little injection point way up here and traveling all the way down through the bloodstream. So it's a very low chance that an injection for a cosmetic reason would even come near the placenta. However, the reason that it's contraindicated in pregnant patients is because it is a cosmetic elective treatment, and we do not test it on pregnant patients. So pregnant ladies were completely excluded from the clinical trials for this. And that's because it's an ethical dilemma. We don't know that something could happen, but we certainly wouldn't want to cause something to happen to the fetus. Now, what we do know from observational studies is that women who did receive a Botox or similar injection from one of these other neurotoxins, and they found out they were pregnant afterwards, or they were injected while they were in the very early stages of pregnancy, they have no higher risk of miscarriage or birth defects than the general population. So just observational studies, it does appear to be safe. However, again, ethically, we can't totally determine that. We did look at this in animal studies, and at doses that were very, very high and toxic to the mother, we did see an effect on the fetus. But again, that is an extremely high dose relative to what we are giving for cosmetic treatments. So the main reason that we don't treat pregnant patients with Botox or other neuromodulators is not because we think it causes harm, but simply because there is a lack of definitive safety data. And pregnant patients cannot ethically be enrolled in these clinical trials to evaluate what would happen. So Botox during pregnancy isn't avoided because it's known to do harm to the fetus. It's avoided simply because we don't know that it's completely safe. And even though the chance of exposure is extremely low and the risk appears to be very low, we just can't in good conscience put a baby at risk. So that is why we recommend to our pregnant patients that they defer their Botox treatments until after they have given birth. Hopefully that answers your questions. And if you have any others or comments, feel free to drop them below.